Hi everyone, it's James Harrison from Connective Chiropractic in Basingstoke here. Now if you don't know me, I am the principal chiropractor and owner of Connective Chiropractic. I'm also a wellbeing speaker and an expert witness, and I also teach at one of the chiropractic colleges too. So in this video, I want to tell you a little bit more about sciatica. Sciatica probably is one of the frequently misdiagnosed issues that we see and talk about within the clinic. And I wanted to give you a bit of information as to why and some of the pitfalls that tend to be going on behind the scenes. So let's first talk a little bit about sciatica or sciatic pain. Now the first thing is sciatica is not a proper diagnosis. So if you get a GP, a chiropractor, an osteopath, physiotherapist, anybody telling you you've got sciatica, the question I would recommend that you ask is, so why? What's causing it? Because sciatica is actually a symptom. Sciatica is that burning sensation you get down your leg when the sciatic nerve is irritated. That's what sciatica is. So the question is, what's irritating the nerve? Because that is the cause of that pain or discomfort. Sciatica as a diagnosis is something you see a lot. And it's everywhere, from medical tomes, even to some chiropractic tomes. They talk about sciatica as a final illness or a diagnosis or a term to suggest you've got something that's going on. But there are actually lots of causes to sciatic pain. So it's not detailed enough. So get that information. What's going on? What's causing it? Now, a key thing that I'm seeing a lot at the moment, since COVID certainly, is GPs saying that people have got sciatica when they've got leg pain. And they keep saying, you've got sciatica. But the reality is sciatica and leg pain are not the same things. You can have many causes of leg pain that are not sciatica. Sciatica is a pinching of the sciatic nerve. And the sciatic nerve, please note, is not just one nerve. It's a bundle of lots of nerves that originate from your lower back and go through what's called a plexus of nerves, so a grouping of nerves, and then bundle into one really rather big nerve that goes right down to the bottom of your foot, down the back of your leg. So if you are getting aches and pains down your leg, but it's not following the distribution of the sciatic nerve, I can tell you automatically it is not true sciatica. But you'll be amazed at how many people don't know that. And we have countless patients who come to see us the first time saying, oh, my specialist, my friend, my whatever has told me this is sciatica, but it comes down the front of my leg, the side of my leg, or the like. Now, neurological pain that could be, but sciatica it is not, in terms of true sciatica, compressing of that sciatic nerve. So please be aware, there's a lot of misinformation out there, including from people who you might see as a specialist. It follows the anatomy of, guess what, the sciatic nerve. So what can create pain down the leg is the next question. Well, there can be lots of issues, from muscular issues, that seems to be one of the most common, down to spinal issues, such as facet issues, for example. So little bony projections where one bone sits on top of the next, they can get locked and they can create irritation in or around those nerves. They can actually be pinching on those nerves, perhaps by a disc. I'm doing running rabbit ears here because often it's not a pinch as we first think, but more an effect from lots of other things that go on in and around the area of those nerves that can create that extra neurological stress down the leg that will create not just necessarily a feeling, that sciatic pain down the leg, but also potentially a loss of function. So some muscular effects, or some effects perhaps in the way that you're walking, your gait, or perhaps even how things feel in general as you're getting up out of a chair or as you're moving. So why am I doing this video? Because I think it's really relevant to know that this is frequently misdiagnosed. And this last week in my clinic, I've had what I'm going to call a bit of a background stand-up row with a couple of local GPs about sciatica. And the reason, I'm going to recap it, because sciatica does not mean leg pain. Sciatica is an impingement or an irritation of the sciatic nerve, which actually isn't just down the leg. There can be a lot of other issues that go on or create such an irritation. So it also is something to know as a prospective patient, as somebody who's experiencing pains down the leg. And if you think that it could be sciatica, what can you do? Well, go and see a healthcare professional that knows about it. So chiropractors are really well placed to know about this. We are trained, we all have to have master's levels degrees in order to know what we're talking about, and then we have the experience day in, day out of what we do. And we see a lot of people with sciatic type pains, or pains down the legs, or pains originating from that lower back. So you can come to us, we will perform some tests so we can decipher what's going on. But please, 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 we have so many people who doubt us when we say, do you know what, this isn't sciatica, but they're adamant it's sciatica because that's where their head is at. We are trained, we know what we're up to, and if we're telling you it's not sciatica, that's a really good thing. So please stop looking online for solutions for sciatica if we've done lots of testing and we can tell you it's not, it's something else. Focus on that something else instead, because you won't help yourself otherwise. So there's lots of ways that you can self-manage different types of pain that go down the leg. Sciatic issues, sometimes they can be quite sinister actually, and sometimes they can be less sinister. You have to know what you're dealing with so you can do what's best for you. And that's where coming to a healthcare practitioner such as myself, such as a chiropractor, can really, really be of benefit. So I hope this video has been useful to know at least that things are often misdiagnosed, including by healthcare practitioners too. And ultimately you have to make sure you know what you're talking about. Dr. Google is a horrific place for things like sciatica. You get a lot of fear mongering going on, and actually you want to have that consistency of knowledge so you know what you're dealing with, you know how to deal with it, and moreover, you know what your action plan is to get out of the aches and pains that hold you back. If you've got any queries or comments, feel free to post them around this video, wherever the links are, or you can email me at james@connectivechiropractic.co.uk. And if you want us to have a little look and see what's going on, of course, I'm very, very happy to see you. You can book via the website, connectivechiropractic.co.uk. But please, please, please be aware that actually, our appointments are very, very, we book up fast basically. So make sure you do so early on so you don't get any disappointments, because there's only one of me and I can only see so many people in one go. But the key thing, make sure you're aware that sciatica is not a diagnosis and that it can mean lots of different things. And if you ever get told you've got sciatica or sciatic pain, the question that you should be asking is, okay, so what's causing it?